Hi friends, welcome to Xiao's Weekly Note. This week we're going to talk about the shoulder. I have a shoulder pain patient. It's a typical patient of a rotator cuff injury. He's in his late 50s, complaining the shoulder pain when he's lying down on the side, and also when he's lifting something, especially when he's trying to take off the shirt. This kind of motion is hurting, and he has a hard time reaching to the back to scratch the back. So he went to the doctor. The ortho did the MRI for him. The ortho referred him to do the MRI. He got a result, confirmed it's a partial tear of a certain rotator cuff tendon of the shoulder. So because it's partial, no need for surgery, he got referred to do physical therapy. That's how he ends up in the clinic. And the therapy so far is very successful. So today we're going to use that case. We'll kind of talk about the anatomy and the structure and the function of the shoulder shortly, and then we're going to see how we can correct some common issue of the shoulder mechanics. Okay, let's start now. All right, let's briefly talk about the anatomy of the shoulder joint now by using this model. This is we call the shoulder girdle. When we say shoulder, actually there are three joints. The second joint is our topic, which is where that patient has his shoulder pain. It's called glenohumeral joint. It's right there. Why is called glenohumeral? Because this is humerus, and this is a glenoid part of the shoulder blade. So the joint between these two pieces of bone is called glenohumeral joint. The third joint is called thoraco-scapular joint. It's the it's the joint between the shoulder blade and the rib cage. Okay, let's jump directly to our patient's issue. I think what he has is because he's a computer engineer, he's a software engineer, so he's sitting a lot, working on the desk a lot. So as you can see, when we work in front of the computer, we start to focus on our task. Unconsciously, we start to slouch. And do you notice that when I slouch, my shoulder blade moves forward to make the rounding of the back. Forward and a little bit going to the side. And when I slouch, look at the glenohumeral joint. See, naturally, it becomes more internally rotated. There's a more internal rotation of the glenohumeral joint. If at the same time I slouch and lean forward on the desk, I'm putting pressure through my elbow to the shoulder joint when this joint is in an internally rotated position. So I'm stiffening the internal rotators. Make the internal rotators of this joint much stiffer because you're trying to stabilize yourself in that position. And your shoulder blade goes forward, so certain muscles get shortened because they learn how to stabilize themselves in that position because of your posture. So remember this conclusion. I think that patient has two issues for us to correct. The first thing is the position of the shoulder blade. The second thing is the position of the glenohumeral joint, which is this is having too much internal rotation, this is going forward too much. Okay, now let's take a look at how to correct those issues. Okay, now let's talk about how to do the stretchings and exercise to correct the issue. But first thing, whoever is watching this, you have to remember a very important principle. That is, if you notice any of the movements or exercise is aggravating the shoulder pain, you should stop immediately. Because remember the mechanism of injury, we're trying to avoid there's overstressing on the joint, on a certain structure of the joint. So the movement, if you're doing correctly, if you're doing the right diagnosis and right treatment, you should not feel the pain during the movement or the exercise or the stretching on your original painful spot. You might feel pain, discomfort on other spots that's tight and stiff. That's totally normal and fine. So, okay, after saying that, now let's take a look. See, remember, we said two things we want to correct. The first thing is the position of the shoulder blade. The second thing is the posture of the glenohumeral joint. But remember, the base of the whole shoulder girdle is the thoracic spine. So if you're missing or lacking the mobility of your thoracic spine or your rib cage, I would say we should correct that first. So the first thing I recommend we do this as a warm-up is you do the breathing exercise. You check yourself. Can you take a deep breath in and look up to the ceiling? And you breathe out, slouch, and you straighten your back. By sitting in a chair, doing this. We're trying to kind of prepare the thoracic spine for the movement. I would say for after 10 breaths, you can start and put the hand, interlace your fingers, put the hand on the back of the head. If that's hurting, you can just put your hand here on the back of the neck with your fingers, and then you try to do the same movement. Try to breathe out, breathe in, breathe out, breathe in. Say after 10 reps, you can do just one way. Breathe out. And the other way, say 10 reps. After 10 reps, try the other way. Breathe out. Say after 10 times, you can go sideways. Remember, you're moving your thoracic spine. It's not much motion of the shoulder or the neck. Breathe in, breathe out. Breathe in. Okay, after that, if you're ready, put your hands on the shoulder and try to make the circle with your elbow, combined with the thoracic movement. Breathing in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. After that, now we can straighten the elbow and try to make circles with your breathing. Okay, so breathe in and breathe out. Breathe in as big as you can. Breathe out. After 10 reps, let's go opposite. Breathe in and breathe out. And remember, if any of these movements are aggravating your shoulder pain, please stop right away and do whatever you can tolerate. Okay, after that, now we can be more specific for the two issues. Remember, if first it's the shoulder blade, the shoulder blade has to go in and down, right? And the glenohumeral joint has to go external rotation. So before we add any resistance, let's just try to learn how to do those movements first. You may be surprised because the body is not conditioned. It might be hard or difficult for you to do that movements in the beginning. So the first thing, see, remember, glenohumeral joint going to external rotation. Without any elevating, you can just keep your elbow down and do this and try to squeeze your shoulder blade and look up at the same time. Breathe in and breathe out. And squeeze the shoulder blade. Let go and squeeze the shoulder blade. Okay, keep going. Yeah, try to make yourself feel comfortable doing these movements, and then you can add little by little, try to elevate your elbow, but without elevating the shoulder. Remember, the shoulder blade has to go down. So practicing elevating the elbow and squeeze your shoulder blade together and doing external rotation. Cool. So squeeze the shoulder blade and keep the shoulder down and move your hand backward to do the external rotation, and go with your breathing. When you do that, breathe in, open up your chest, breathe out, and breathe in, and breathe out. Okay, and then after you're familiar with those movements, eventually you can elevate the elbow to the shoulder level, keep the shoulder down, and then do the same thing. When you do this, if you try really hard, see, without resistance, if you try really hard, you might feel some muscles are cramping. That means that muscle is not that strong in that range. That also means you have to train that more. So breathe in, breathe out, breathe in, breathe out. Okay, after that, now let's see how we can stretch those tight muscles. Because you might feel the pectoralis muscle, the chest muscles are tight, limiting your range of motion. If that's the case, don't worry. You can also do some stretchings first before you engage those movements. Let's see. Okay, now let's take a look at how to stretch out those tight muscles. The major one is going to be the pectoralis major muscle and the minor muscle, which is the chest muscle. So you just have to find something that is stable you can anchor your hand onto, and then try to have the hand go below your shoulder level, and try to keep your elbow straight. That's also a part of the detail. Keep your elbow straight, you can stretch out more the fascia there. And then try to turn away from the side, and remember the shoulder blade position, you want it to be down and in, so try to actively engage the shoulder blade. When you do that, you feel more stretching on the front. Okay, now is the secret. What is actually helping you to stretch is your breathing. So if you don't focus on your breathing, it's not going to stretch much. But if you try to get to the position and try to take a deep breath in, and try to feel the stretching of the pectoralis major muscle, also the minor there. You can even feel some tingling down to the biceps area, but that's the proper way. Try to stretch by breathing in and breathe out. You see, after a few breaths, you're able to turn a little bit more, and keep going. But remember, anytime anything that's aggravating the pain, you have to stop right away. Okay, let's take a look at the next one. Okay, the next thing is to do the stretching, still on the pec muscles, the chest muscles. But this time you don't even need equipment. You can just in standing or in sitting, as long as in the upright position, try to interlace your fingers on the back, and then straighten your arms until you feel the stretching. And then remember the shoulder blade position is in and down, and then try to hold that position and try to elevate your hands off your buttocks, and at the same time breathe in. So let's try. So take a deep breath in. At the same time, you also look up again, breathe in. Remember, keep the elbow straight and breathe in. And try to repeat about 10 breaths, or keep going until you feel the muscles are loosening up. You can do a similar thing, but this time on the floor. So you try to get on the floor. You can put your hands down on the floor, pointing the fingers backward, or you can just make a fist. Or if you have a hard time, just hold a weight or something in the hand, so easier for you to balance yourself. Make a fist. I'm going to demonstrate with the fist. Remember shoulder blade position, in and down. Okay, and then try to elevate your buttocks, your pelvis, and try to breathe in. You can move up and down. Breathe in, or you can just hold the position always remember your shoulder blade position. So this one is not only stretching, but also helping you to build up some muscles on the back. Okay, now after getting more familiar with those movements, now we're going to add some resistance. But remember, we're training the body to do the right movement, so you don't need a lot of resistance in the beginning. Actually, I think overall you don't need a lot of resistance for this exercise because we're training, remember, some small muscles that's stabilizing the shoulder joint or some postural muscles. So we don't need a lot of strength, but we need more stamina, need the endurance of the muscle. So I'm going to demonstrate with the rubber band. Remember, get the rubber band with low resistance, and we're going to do higher repetitions. Okay, so find something stable. Remember that movement. See, and this movement first. If you're doing this, you hold the rubber band at the side, right? And then you do movement like that, remember? And some people say you have to put the pillow between your elbow and your torso, so you kind of keep the joint in neutral position. Ideally, I suggest you just try to hold it in the position. Don't move the elbow. Remember, you're doing external rotation of the glenohumeral joint and you're holding your shoulder blade. So you're doing two things at the same time. Remember, shoulder blade position and the glenohumeral joint external rotation. Okay, when you're getting better, you can start to elevate the elbow. So remember, now you have to change the direction of the resistance by going backward like that. Eventually, keep your elbow on the shoulder level, doing external rotation. Remember, you don't need a lot of resistance, but you need more stamina. So trying to do more repetitions, you can feel the muscles burning. But don't go fast, okay? Remember, it's a postural muscle. So the contraction should be slow and stable, okay? Okay, another way to do this is to lay down with the weight. Remember, we want to strengthen the muscles that's holding the shoulder blade in and down and doing the external rotation at the same time. So first thing, you can lay down on the side. Remember, hold the shoulder blade in and down, and then try to externally rotate the glenohumeral joint by holding a light weight. Remember, the contraction should be steady and slow. But try to do more repetitions. You want to train the stamina of the muscle. As to the other one, you can actually move to the edge of the table. Okay, now it's another way to strengthen the same group of muscle, but in a more advanced way. Remember, is to elevate the elbow to the shoulder level. I'm going to demonstrate now. So trying to hold the weight. Remember, shoulder blade position in and down. Okay, and then without moving the shoulder, you're trying to do external rotation of the glenohumeral joint with the weight. I think it's the easier way just to get a rubber band. You can do it in different position. If you don't have a rubber band, don't worry. Just grab a light weight, even 3-pounder, 2-pounder, even 1-pounder can work. But remember, work on the stamina, the endurance of the muscle. So move slowly and steadily without explosive movements. Okay, that's it. Okay, that concludes our video. Some final words here. I just want to say there are many different kinds of diagnosis for shoulder pain. This might not be applied to you in your condition, but this is the treatment usually for the most common shoulder issue I've seen in the clinic. However, in the clinic, the first thing we do is trying to loosen up the tight muscles first. So it's more possible for you to move the joint in a more appropriate way. So without doing that, you might not feel much of the benefits. If that's the case, you should have someone who's specialized in loosening up the tight muscles, experienced ones, to help you to start the process of healing. Okay, thank you very much. Hope to see you soon. Bye.